Common question we get is, what type of implant am I going to get? What are the different profiles? Or patients come in asking for a specific profile. So in the United States, there's really just two types of implants that are used. There's saline, which are water-filled, and there's silicone gel-filled implants. We use mostly Allergan products. Allergan kind of come in three different consistencies with their implants. They're all round. There's a old school kind of softer gel, which is called a responsive gel. Super soft, but a lot of collapse and more wrinkling. Over time, they developed a thicker version of this, the silicone gel. They made it thicker and called a soft touch implant. It's kind of like the Goldilocks implant. It's a medium thickness device. It's designed to still have a little natural contour with gravity when it sits up, but it's not too hard, it's not too soft. It's a nice implant for someone looking for a little bit more of a natural appearance. The one that's become really the most popular implant is the gummy bear implant. So they took the soft touch implant, simply thickened the gel more and made it a more cohesive silicone gel. So it's a thicker molecule. You hold it up, there's a minimal amount of collapse. It gives you nice fill to the upper pole of the breast and the least amount of wrinkling. Called a gummy bear because the silicone gel inside of it, like this, if you cut it in half, it has a very thick consistency, similar to like a gummy bear consistency, almost like a taffy. It's not a gummy bear, it's just a very thick silicone gel. And we hope that, if it does leak or rupture, that it will have minimal leakage that occurs over time. You can't say it won't leak, but we have not seen it typically leak past the scar tissue that would surround an implant. Implants also come in different profiles. There's more of a lower, flatter profile, which is kind of a flat looking implant. This is called a moderate device. They're wider, they're taller, and have a little bit less projection. The high profile implants are designed to have a more narrow base width, but give a lot of projection. They're designed for someone who has a more narrow width breast who wants more projection outward. So your surgeon will typically choose the profile that fits your breast. Patients frequently ask for a specific type. I want a high profile, I want this, I want that. Your surgeon will usually pick that based on your anatomic measurements and what your outcomes are you want. You want a much fuller breast, you want more cleavage, you want more height. I tell my patients that we listen to you, we understand what you want, but when you're choosing this, you want your surgeon to choose the proper size implant for the base width of your breast, how much cleavage, how much height you want, and how much projection. So that's how we choose that. It's not simple, everybody's a high profile, everybody's a moderate profile. Everybody's different, and again, we use anatomic measurements to make those determinations.